So I was really pleased to present the first data at ICML this year of the AVENuE study. And the AVENuE study was a UK study. It was a window study looking at 4 doses of Avelumab, which is a PD-L1 inhibitor, in the frontline treatment of advanced classical Hodgkin lymphoma, followed by a response-adapted chemotherapy approach. Many of us know it as the RATTLE study. So 2 ABVDs, PET negative 4 AVDs, PET positive 4 escalated BCOP or BCOP DAX. But the question we were really asking is the safety and efficacy of those 4 doses of Avelumab up front. Now, Avelumab, so many people have looked at checkpoint inhibition before chemotherapy in frontline Hodgkin, but they focused on PD-1 inhibition, so nivolumab, pembrolizumab. We were interested in PD-L1 inhibition, so the ligand, and this is actually the first study reporting on PD-L1 inhibition in that setting. We had 47 patients. We were looking for a response rate of over 40%, and in fact the response rate we had was 44%, so it was a positive study. There were some immune-related reactions as you would expect, colitis, pneumonitis, thyroid disturbances, so there are toxicities of checkpoint inhibitors, as we know. A key secondary endpoint was deliverability of subsequent chemo, and in fact we managed to get an 89% chemotherapy cycles were delivered on time, which was exactly the same as the RATTLE study, so that's reassuring. And we had a 1-year progression-free survival of 100%, which was great, although there have been 2 relapses since then. So I think my interpretation of that is it adds to the body of literature which show that checkpoint inhibition in frontline Hodgkin leads to very high and durable remission rates. And actually we saw a randomized study, the SWOG study presented comparing AVD brentuximab with AVD nivolumab, showing superiority at a 1-year progression-free survival, so quite an early time point, of AVD nivolumab. So I'm sure we're going to see more use of checkpoint inhibitors up front.